morning and welcome to another episode of Healing Our Communities. I'm your host, Heather McDaniel, Vice President of the West Virginia Drug Intervention Institute. And today I have a very special guest with us who is not just a wonderful person and wonderful friend to the Institute, Cece Brown. Cece was previously a state employee and has a special commitment to fighting the substance use epidemic, Overdose, and tirelessly volunteers along with her husband Bobby at many, many events. If you attend any events in Charleston, you will likely see Bobby and Cece there. Welcome, Cece, to Healing Our Communities. We're so glad to have you here today.
Thank you.
We're excited to talk to you and let our viewers learn more about you and why the work that you guys do is so important to you and to others. So let's get started by letting people get to know a little bit about you outside of the cause and why you guys are so committed to this. Can you just share a little bit about yourself, what you like to do for fun, not related to all of this extra stuff that you guys do?
Well, we are recently retired, and one of the things we enjoy is travel now. And that's something that's very important to us. We enjoy spending time with family and friends because we think those social interactions are just critical to life in general. And so that's kind of what we're doing right now. We want to focus on enjoying our life, spending with people that we care about, causes we care about, and you know, just spending time within just a good venue in our life, and that's important, I think.
Yeah, and I can vouch that they are definitely traveling. Cece has joined some Zoom calls lately from Texas, so I was actually glad when I asked you to be here that you were back in West Virginia. After I sent the email, I'm like, oh no, she might not even be in the state. But so Cece also previously was a state employee for the state of West Virginia. Can you talk a little bit about what your role there was and the work that you did there?
When I retired, I was the Medicaid director with the Bureau of Senior Services. And prior to that, I was the quality assurance officer there for Medicaid in-home care programs. I also worked at the Bureau for Medical Services with a lot of the in-home care and some hospital programs and institutional programs. And then I also worked for the Bureau for Behavioral Health prior to that at the state. And I worked in the private sector with an independent provider for a while too, actually my background is clinical, and I don't really refer to that. It's probably maybe my first time that I've mentioned that, but I do have a clinical background.
Yeah, so you were a social worker,
Yes.
which ironically very much relates to the cause that you guys are so supportive of and the work that you do now in retirement.
And had no idea that we would end up doing that, right, on a personal
intertwine
level.
this way. Yeah. So would you mind sharing with us about what brought you to this fight against overdose?
One of the things that happened to us, our son Ryan Brown, for 7 years he struggled with a substance use disorder. And in and out of programs and on medication-assisted treatment, and it was really a difficult path for him. And right before he died, he was on a wait list for 2 programs. And he also got his Medicaid card 3 days before through the Affordable Care Act. And so I knew that that would open doors for him that he didn't have before. That was prior to us having the substance use disorder waiver here in the state, who hadn't been approved yet, hadn't even been submitted and thought about yet. By Friday, he overdosed on heroin at the Town Center Mall in Macy's. And we got the call that night, that evening. He was actually out helping a friend. They were working on a political campaign, and he was passing things out. He had been doing really well. And then someone met him at the mall, and all of a sudden, you know, he used heroin. He actually had this opioid addiction. One of the problems is he'd gone for to have oral surgery, and they'd given him a 30-day supply of medication, pain medicine, And that, I think, started it. This was while he was in college. He was in Morgantown at WVU. And then going back, getting into, the party scene, he ended up actually smoking heroin at that time, and I had no clue. As a parent, I think I was probably naive, so I would encourage families to get educated because I did not know that you could do that. And so I feel like you have to be honest about it, and let people know that, and that's what happened. And so I'll never forget the day that we had 2 detectives come to our door to tell us, and it was the worst day of my life.
Imagine.
Yeah. And so that's why we knew that overdose could be prevented, because then you couldn't use naloxone, families couldn't use it, even policemen couldn't use it. The only people that could give naloxone for an overdose was someone who was in the hospital, so hospital staff, or ambulance staff, EMT or paramedic. And so I knew all that had to change, that there was hope, and that was where we came from. We only wanted to make a difference. If it helped one person, that was really what we set out to do.
And boy, has what you guys done made a difference. And we're going to talk a little bit later about some of the work that you guys have done, and some things you've helped get passed in the legislature just for funding, and look at where we're at now with naloxone, how before, you're right, no one could give it, and now you can get it over the counter, which is just a light years advancement, which we know has saved so many lives, thankfully. And can you tell us a little bit about Ryan's Hope? That's kind of an organization that you guys started, and the work that you aim to do with that.
What we set out is, again, to spread a message of hope, that we wanted to educate people about substance use disorder, and about overdose, that we felt like at that point it was important to raise awareness. No one was talking about it. And one of the things I said, I wasn't talking about it either. And when we lost him, my husband and I said, we're coming out of the closet about addiction, because we felt like people needed to talk about it, and to be fearless about talking about it, and not pay attention, to the hum in the background, people being negative and stigma. I don't listen to that. I don't listen to it, because it's too important. Our lives of our sons and daughters are too important not to talk about it.
Absolutely, I couldn't agree more. And I think what you said earlier about educating parents is so important, because there are so many parents that have no idea the signs of addiction, would have no idea that their child is using, and are probably a little bit naive about it and think it could never happen to them, but you and I know it can happen to any family, anywhere. And I think that, what you guys do really does help educate people that, hey, this can happen to anybody.
That's right.
You have to wake up and realize it could be your son or daughter, or your mom or dad, or anyone in your life. So I mentioned earlier that you and Bobby tirelessly volunteer, and you guys do. You are at so much. Aside from Overdose Awareness Day, which we'll talk about later, can you talk about some of the other events that you guys volunteer at, or that you've been a part of since losing Ryan?
Oh gosh, we have been, well, almost
Everything?
any event,
Yes.
that there is, in town and also statewide. We've been to some national things as well. We've been to the White House a few times, for round tables and other things, because for us, we don't go for the politics. We feel like it's important to not allow anyone to stifle your voice, and what needs to happen. And so no matter who it is, and I think sometimes people back away from that because of that. So it's important to speak up. We work with some of the providers when there's locally when there's like a recovery celebration. Yes. September's Recovery Month, and we will try to get to as many as we can locally. One of the reasons that we do that is because we think it's very important to support and uplift those in recovery, and also with the families as well. So, we just really try to be there for people whenever there's something going on.
Yep,
Yeah.
and you definitely are. We see you all the time.
I know.
But that's a great thing. That's a good thing because
Well,
we need more people to attend and raise awareness.
Yeah, and that is something that I didn't see a lot of families doing, is supporting people in recovery. And I think that's important. That's why we do it, is that they need to know that there are people out there that care about them.
Absolutely. And I think it's great for other families to see you guys doing that, because a lot of time parents feel completely isolated when they're dealing with the addiction of their child, and they feel like they're the only people going through that. So seeing you guys out there gives them hope that, you know, they've made it through this, even after such a horrible, tragic event, that there's hope for them too.
I've had people come up to me, families who have lost someone, and say to me, you know, when I lost my son or daughter, I thought of you all. And you know, to know that this was something that, while it was devastating, that they knew that they could get through it too. Because you can, at one point, you know, you'll realize that you can have, you know, sadness and joy in your heart. And it takes a while, but I think that's important, to be involved. And also giving back, you know, families work the 12 steps. So looking at service, how you can give back. And, you know, I remember telling a couple of gentlemen in recovery, we'd been down at the Capitol for something, and I said, I didn't realize that initially, that helping others was going to help me, but it did. And he said, what do you think what do you think it's all about, you know? And I said, yeah, you're exactly right. You're exactly right. And so it took me a while to figure that out, but it is. And I would encourage families to do service, because it is, it helps you heal and recover. Families need to heal and recover too.
Absolutely, absolutely. Yeah. Well, we are going to take a very quick break, and when we come back, we'll continue talking with Cece Brown here on Healing Our Communities.
Research indicates that the majority of students misusing prescription stimulants as study aids earn lower grades. Here's the good news. 81% of college students do not misuse prescription medication as study aids. Staying current with class material, prioritizing tasks, and accessing tutoring and online tutorials are just some of the ways you can stay stimulant-free. And remember, never share your prescription medications. Need some advice for how to do this? Visit wvdii.org.
Hi everyone, and welcome back to Healing Our Communities. I'm Heather McDaniel, Vice President of the West Virginia Drug Intervention Institute, and we are continuing to talk today with Cece Brown. Now, Cece, we mentioned briefly before the break Overdose Awareness Day and said we'd talk about that later, so we're going to talk about that. I know a lot of viewers probably know about that, especially if they are in the Charleston area, and really statewide now, I would say. But if not, we know that that is an event held every year here in Charleston. But what they might not know is that it was started by you and Bobby. Can you talk about that first year and getting that event going?
Yes. After we lost Ryan that first year, I kept seeing this International Overdose Awareness Day, and I wasn't seeing anything at all in our area. No one was raising awareness, celebrating, and remembering anyone. And I thought, I waited for a while, and thinking, well, somebody surely is going to do this, you know. I didn't think I would do it, you know, because this was not who we were. We didn't do this kind of work. And so then I decided, okay, I'm going to get up off the couch and do it. I had no idea how to do an event like this or what we were doing, but I began to get connected with some really good people. And through that, we decided to have it. And actually, the very first one that we did, we actually were going to have it over. Ryan has a remembrance tree that was planted on the boulevard, and it's right across from between the Capitol and the Governor's Mansion. And the reason it's there is because that was what the places that they offered us, you know, when my sister planted that. So I had thought about having it there, And my husband said, we need to probably go across the street because, it's not very big at the Capitol. And I thought, well, maybe we'll have probably a dozen people show up. We had 350 come. And so the format I've tried to keep is the beginning. We want to remember those we've lost, and we want to recognize the families and friends that have lost someone. I kept seeing people in recovery that had lost person after person after person, and no one was talking about it, no one was remembering them. And then the last part, I wanted to offer hope, because I didn't want people walking away, feeling, oh, okay, this is all that can happen.
Yeah.
There's more to that. So that's what we did, and I've tried to get the news out to everyone, and it was just unbelievable that there were so many people who wanted the person remembered, and we actually read the names, like they did with the Holocaust victims. And I didn't know we would have so many. We had like about 350, 60 people. And the one that was the most touching, I had a young lady who sent me a message, and she said, I want to remember my sister. She's never been remembered, and my parents never recognized her, her life, because she died of an overdose, and they were ashamed. And so what I told her that day, I said, you know what? Your sister will be the very first person we remember.
Oh.
So she could have an opportunity to remember her life, because that's not all of who they were.
Right.
And they were much more than that. And so anyway, that's what we did. And so each year, as years went along, we tried to bring in more hope and uplifting, because I think one year it was Hope is in the Air, because we felt like it was time to move people along, and that's sort of what we did. And we try to get the community involved in it as well.
Yeah, I think the participation has been great, and it does seem like every year it gets a little bit bigger. There's more providers there, there's more going on. Last year's event was a little bit different than previous years. Can you talk a little bit about that? And we at the Institute were so fortunate to be really involved, but if you could talk about that a little bit and how that was different from what had been done before.
Well, okay, it was a hope and recovery block party, because again, we just kept pushing the envelope and wanting to make sure that that we don't leave people behind, we don't not remember them, that we do. But then also we started lifting people up. And so we had a block party, and it was at downtown at the Slack Plaza, and we had music, we had bands, we had people singing, like rap, and we had a food truck, people could have free food, T-shirts and providers. But the one thing that has been consistent with every single one, we have naloxone training and providing naloxone to people who want it and need it. And because we want to make sure that we, infuse the families and also, anyone who wants it, because you never know when you're going to run into someone that is overdosing. And better to be prepared, like with your first aid kit. Put naloxone in it, carry it with you, put it in your car, have it at your home, because it's important to use it. So that was kind of the gist of it. So it was different because we felt like our community was ready for that.
I think we had a great turnout. We were able to train everybody there from the stage with the one box, and there was a lot of naloxone given out that day.
Yes.
The attendance was great. Kids were excited. There was a balloon artist there, which the kids loved too. So, yeah, it just continues every single year to get bigger and bigger, which is great that the community has embraced that event.
And you have to have someone that's alive that can get into recovery.
Yeah.
Because we do hear some backlash, at times. And, I want to be honest about this, that people will say, well, how many times do you give naloxone? Okay, I say every time. Because that person does not know what that family is going through. And so every time there's an opportunity, I think Jan Rader on your one box, that's kind of been her stance. she believes that, and she's been a cheerleader for that, and I'm on her side.
Yeah, absolutely. I mean, it could be 10 times, but maybe that 10th time is the time
Right.
that somebody's able to get into recovery and maintain
Yeah.
that for the rest of their life. And why would we take that opportunity away
That's
from
right.
them? I agree.
That's right.
So I know you and Bobby have been invited so many places to speak, which has been great. And you mentioned a little bit earlier that you guys were invited to the White House, which is a huge deal. Can you talk a little bit about that experience?
Well, we were very surprised, In fact, when I got the email, I was thinking, okay, well, is this real,
Right, yes, this is spam email.
Yeah, was this spam? I wasn't sure. But, and I debated about whether to do that or not, because, in fact, I remember going to bed that night, I hadn't answered the email, thinking, there had been something on, television about, the drug companies and what was happening, and, and it was really overwhelming. And I thought, I'm not sure. What kind of good will this do? And then I thought, okay, I'm not going to let that happen. I'm going to speak. So we were invited to the First Lady, Melania Trump's roundtable, and there were only a couple of parents there. And there were 13 either providers, people in recovery, or parents. And it was an opportunity to share what was happening, not just with us, but with everybody, with what kind of things we needed in our state. And of course, after that, we got the SUD waiver in this state, which was has been extremely helpful. But, and then we were invited back, when, he declared that national emergency, and then also another time, 2 more times. We only were able to go one other time. And when Obama came here, we were invited to that. We weren't able to come as we were out of the country at the time. But those opportunities, I see them as opportunities to share what's going on and what kind of things that we need to focus on. It's important. And if people choose to listen, at that point, that's wonderful. But sometimes, I remember, because we're a big supporter of the Affordable Care Act because of Ryan and when he got his Medicaid card, because he couldn't get, health care. And right before we went, they were, saying we need to get rid of affordable health care, and they were running that through Congress, and it hadn't gone through, thank God. But I was interviewed. They said there would be a couple of us interviewed, and I was one of them, and I was able to say something about that, and of course about Ryan, and that video went all over the country. And the reason that's important is that people need to know, and that would not have happened otherwise,
right.
And so I do have a concern, that comes up every once in a while, that people don't see a need for that, but it can be life-saving. And when you're thinking about if it, I always use this, I always think about this, there by the grace of God go I. It could be any of us. And so I think people forget that it could be any of us. And so looking at all of that, it's important. But that's some of the things we've done. And we went to the legislature 2 years in a row to get the Ryan Brown Prevention Recovery Fund Act passed.
Yeah, can you talk a little? I was actually going to ask
sorry.
about that. No, you're part. It was actually you segued right into that. How important that was for West Virginia and for treatment. The Ryan Brown Addiction Prevention Recovery Fund. If you can talk a little bit about that, that'd be great.
Well, at the time, Ryan was on a wait list, and I knew that we needed more beds in West Virginia. And, my background was like systems, a lot of quality. And so I was looking at that. I did research. I didn't just go to the Capitol and say, hey, can we do this? Because I did research to see what kind of things we needed. And I looked at national programs and what was going on and what kind of things worked. And so when the first year, Chris Stansberry was a delegate at the time, and then Andrew Robinson is the one that went in the second year to get it through. Didn't go through the first year, got stuck in budget, which happens a lot of times. Yes. But they were able to tap into the settlement money from the pharmaceutical companies to use that. And people don't realize how hard it is to start up, either add beds or to start a program. because you don't really get money until you start billing,
Right.
insurance or
Right.
whoever it is, or payment. And so you have to, kind of patchwork it together. So that's one of the reasons we did that. We wanted to see how can we facilitate more treatment beds. So the first approval went through, and it was for treatment beds, and they added like 400 plus. And then after that, it was recovery residences, and I don't know exactly what the end amount was, but it was able to create. We needed an infrastructure in West Virginia. We didn't have that, and we had a few spotty,
Right.
treatment options. And but they needed to have some way to do that, and so that was why that was so important. And since then, one of the places that I remember seeing this young man was trying to get across over to our side of the state from Martinsburg, and they had nothing over there. And he was coming, and he overdosed before he got to the treatment. And so, that was really critical, because now they have resources over there. Yes.
They have treatment and recovery housing,
Yes.
which is great. Yeah.
And that was one of the things that was really, I think, important to me, is that they were even like getting a chain of people to drive people across the state, to try to get them there. And I'm thinking, gosh, you shouldn't have to do that.
Yeah, and now it's so much more accessible than what it used to be, which is
Yeah.
fantastic. So one last thing before we go, Overdose Awareness Day is coming up soon. Can you just share the date, time, and location for this year's event for anyone that would be interested in attending?
I can. It's August 31st, and it will be at the state capitol on the Riverside from 6 p.m. to 8 p.m. And we will have music. We're going to have a band again, and we will have, the balloons for the kids. They do balloon animals for the kids, and we're going to have speakers, and and a lot of networking, and we will be remembering people. But I also want people to walk away thinking, I have some hope, and also I've had fun, because people forget to have fun.
Yes.
And I know that's not something that you usually put with that kind of event, but I think that life happens, and I think we need to figure out how to embrace life to the fullest.
Absolutely.
Yeah.
Well, thank you so much for joining
Thank
us
you.
today. If anyone would like more details about Overdose Awareness Day, you can go to the West Virginia Drug Intervention Institute's Facebook page. There's an event created there, and you'll see some more coming out about that soon. I just want to thank Cece so much for being here today. We really appreciate you coming and talking about what's not always an easy subject to talk about. For everyone else, thanks for tuning in, and we'll see you next time on Healing Our Communities.